over to Dr. Larcos Sierra, who from WHO is the head of the, I can never say M&D unit, in the management unit in the non-communicable disease department of WHO, who is going to give some closing remarks. Thank you.
So hello to everyone. How is the level of energy? So the best it can get, the worst it can get. Tell me, best, worst, where are you? Okay, that looks fantastic. So, but I will not take it as an indication of the time that I want to talk. Huh? So, look, thank you for giving me the opportunity actually to listen to the outcomes of these 2 days and really to listen to the deliberations. And look, without wanting to repeat what it has been said, but there is like three words that I take with me from what it has been said. The first is the connection. The second one is priorities, and the third one is learning. And look, in terms of connection, and of course, I will elaborate a little bit, only a little bit, despite of you being high in energy, or reflecting a little bit on at some point on WHO. But look, so what resonates with me and what you have been talking about connection is really a connection within the NCD agenda. So not forgetting that, of course, you are concentrating on diabetes, but we don't need to overlook that diabetes is much connected with other disease areas that are extremely important to take into consideration and that we need also to bring along in whatever we do. And that is, of course, as you already do in the area of dialysis, but it's also cancer, it's cardiovascular diseases, and so on. And it is also connection in the broader health agenda. It has been great to hear and also to know that colleagues from WHO came to introduce also the work on pregnancy and diabetes, but also that you were mentioning connection with other areas of health, and whether it is mental health, for example, and without forgetting also those. But actually, what also extremely resonated with me, and you will hear much more of that moving forward over the years to come from WHO, is taking a health systems perspective and health system strengthening perspective when we talk about NCD services. We cannot concentrate only on services. We need to concentrate on actually what drives us in the health system that will enable that, especially in the preparedness and resilience, contribute to the services being available. So you will hear from WHO moving forward, this narrative is not enough to implement projects, it's not enough to concentrate on delivering evidence-based care, and evidence-based interventions is really about strengthening the system to be able to provide those, whether it is from the perspective of health financing, workforce, governance, and of course, medicines and health products, and so on. And of course, is connection with other sectors. I think it was one of the topics very strongly, food, nutrition. I think today came private sector, what I think is good that it came now mentioned at the end. So to move this agenda forward, that it comes, this message connect with other sectors also is resonate a lot with what WHO sees this agenda moving forward. And look, also a couple of reflections, because probably has not been much of the discussion how WHO is moving, or how we are operationalizing so that everyone is aware the connections within WHO. As you know, what is good from the perspective of IIDA, that we have a main focal point for this agenda in the NCD management part of the organization, that is Kiran with us, but also moving forward, we have a person in the WHO emergency program working specifically on NCDs. So to ensure that not only we do it in NCDs, but also really connect with all the emergency preparedness and response in WHO. And also linking to the word connection, we are connecting across the 3 levels of the organization, and what we are doing is also starting with 3 main regions, having a focal point in Afro, in Cerro, and in Europe for NCDs in emergencies, and in addition to that, in focus countries to have at least a national professional officer working on this agenda, so that we ensure also from our side that there is connection across the 3 levels of the organization. And look, I hope also moving forward to connect with AIDA in those efforts, especially when we work at country level. So just to mention to all of you, what are the countries that has been prioritized from our side at this point is in our Eastern Mediterranean region is Yemen, Somalia, and Sudan. So there will be a person there specifically working on in this agenda. Then in Afro is Burkina Faso and Sudan. In Euro is Ukraine and Moldova. And in the Southeast Asia region is Myanmar and Bangladesh. So let's really moving forward connect and also when we move this agenda forward at country level. And look, I go to my second word. So if I leave connection and go to priorities, and look, WHO is coming out of a painful process of prioritization. I cannot even say the word, but so it's difficult to set priorities, and I think you will move forward, narrow down those priorities, and what I want to say at this point, let's also connect whether it is in service or access or research to connect on what needs to be done from WHO side, and it is meaningful, but also where IIDA can contribute in a more meaningful way. And I think we would be, and it is an offer from a WHO perspective, being very keen to look at the research priorities, because we know that our colleagues from the WHO emergency program tell us, look, the evidence is there for certain things, even if WHO has certain limitations for putting forward recommendations for specific issues. If organizations like AIDA have conducted the research and put forward also certain recommendations, if the evidence is there, even if from the programmatic point of view we have difficulties of pushing them from the emergency part of the organization, if everything is backed by evidence, is easier for us to implement. So it's really an offer to move forward in a coordinated manner in all the areas, but also especially in the area of research. And of course, Kiran has already mentioned, look, let's align with and finalize the this plan of indicators because for the indicators, because a lot of work has been done from our side, and it is probably meaningful that WHO is the one moving forward with this, putting these norms and standards. And look, the final, and I leave the priorities, that is, will be work in process, and let's connect for those priorities. And in terms of learning, because I think one important message is, what I would say is meaningful learning from people with lived experience. It's, we get lost sometimes in this meaningful engagement. It's meaningful learning, and really for with whom we connect and why and how, but also setting the priorities. And it caught my attention that this meaningful learning only came in the summary of the services, the priorities of the services. So just a reflection of how if we discuss it, and we know in WHO that it's not easy. We struggle also a lot when we try to, whatever we do, also for our normative work or the country implementation, to meaningful learn from people with lived experience, that we really take it forward, and just a reflection that it only came in the service priorities. It only came up in the service priorities. So it is really, let's connect, looking then forward to your priorities, and thereby really learning from people with lived experience. And then last, because I went through the 3 words, from connection, priorities, and learning, so to say a big thank you again for really always reaching out, and I want to emphasize that. So it's really Sylvia always reaching out to WHO to really engage with us. We really appreciate it, and look forward to continue doing so. And for welcoming us in different ways, also at this symposium. And look, I also need to, from WHO side, give a big thank you to the Novo Nordisk Foundation, because we can only move forward this work in WHO because we have the support of Novo Nordisk Foundation, but of course then in relation to diabetes specific is also Hemsley, the organization that is behind most of the work that we do in diabetes. So there is a big thank you to these 2 foundations for making also this happen and all the work happen in WHO. So I think that was all from my side, but there is a big announcement now for what is coming up, and I pass the floor to you. So great, thank you.